Thank you for joining us this afternoon and braving the weather. My name is Payam Barnaghi. I'm an academic. I work in Brain Sciences Department at Imperial. By background, I'm a computer scientist. And this panel is going to be on resilience and aging. My colleagues will start introducing themselves as we start speaking. But we have a broad range of representing the funders, investors, and industry and public sector. We will take something probably around 30 minutes to go through just a panel introduction and some preliminary questions. Then we'll stop and we'll take questions from the audience, and let's see how it goes. Chris, we start with you first. You represent UKRI. This is UK Research and Innovation, and you are the funding body and the public sector. And the healthy aging call, as part of the UKRI, I understand it started around 2018 and has been running for the past 4 years. What is actually healthy aging from your perspectives? What are the themes, and what do you expect to be the best outcome of all this investment you are making?
Good afternoon. Yeah, I'm Chris Ward, part of the Healthy Aging Challenge team. There's a number of us. I don't represent the entire team. But yeah, back in 2018, I wrote down the exact wording to make sure I got it right. Theresa May, for those people that can remember that far back, she said, we should ensure that people can enjoy at least 5 extra healthy, independent years of life by 2035, while narrowing the gap between the richest and the poorest. And obviously there's a lot of scope in there, a massive breadth of impact to be achieved. And in some respects, there's a kind of complacency that actually maybe we were gliding towards this anyway.
But Chris, we have had 5 prime ministers since. Has it changed, or is still the same?
Well, luckily, this is part of the continuity of kind of challenge-type industrial strategy funding. So the money was put in place, £98 million, that was going to fund effectively a 4-year programme of work, which is just coming to a conclusion at the end of this March. So for those people hoping to get a last bit of money, I'm afraid you've pretty well missed the boat there, I'm afraid. But actually, it's going to flow through. Obviously, my ambition is that this would be repeated by any flavour of government coming forward. And there should be continuity in this space, because healthy ageing affects us all. We should be taking this extremely personally.
Excellent. Thanks, Chris. We hope the take-home message by the end of discussion today for the audience and for all of us will be how we can work together between public sector, private sector, academia within White City, and how we can use the expertise around the room and all the expertise available to improve the outcomes of healthy aging and improve generally the health outcomes of the population. Nikki, you represent the public sector, and what healthy aging is for you and for the users you help and support?
I mean, healthy aging is a really interesting concept. We actually measure it in public health. We look at disability-free life expectancy and also healthy life expectancy. And what's particularly shocking, but wouldn't shock a lot of the audience, is that where you live and your poverty affects both of those markers, which we look at very closely in the borough. So we certainly have differentials in life expectancy and healthy life expectancy. I think the other thing to remember is that healthy life expectancy isn't equally distributed. So speaking with my colleague on the panel, we know that particular groups of people have fewer healthy years in them because there's so much stacked against them. So people with severe and enduring mental illness, people with a lived experience of homelessness, people with contact with the criminal justice system, etc., they have fewer years of healthy life expectancy, and in fact, they die earlier. So those are really shocking things that we have known for a long time in public health, but we tried to even the playing field for everybody through public health measures, which are universal, but also targeted. And those particular populations are of interest to me.
Your borough represents a very diverse community, right? Always the assumption is if you're in London, you're has better access to all the services. But in reality, also in London, there is a huge diversity. Is that?
Absolutely. And people always think that it's health services that have the biggest impact on people's health. That only makes up about 20% of people's health. It's the wider, what we call them wider determinants of health. So employment, jobs, green spaces, pollution, all that stuff has a bigger impact on your public health per se than health services. And we have differentials in the borough as well. I don't know if any of you live in the borough, but we certainly have deprivation and then great riches as well.
Thank you, Nikki. Divya, your company is in the forefront of some of the biomarkers which will improve the health outcomes. Brief introduction about your role and what do you think, like how your work or other advancements in the current sort of biomarkers or digital biomarkers is going to help with the healthy aging?
Absolutely. Hello, everyone. I'm Dhivya Venkat. I'm CEO and co-founder of Esya Labs. What we're doing at Esya is looking to improve cognitive longevity. And what we mean by that is if you look at aging well, everyone wants to age well. And today with the NHS, the average age at which you have a chronic condition, and what I mean by that, the point at which you depend on taking medication is shockingly around 64, after which you end up needing to take medication every day. So what we want to do is we want to live well for longer. And in order to do that, we need to have preventative diagnostics. How can we identify onset of diseases earlier? And what can we do to stage an intervention before you develop the disease? And our focus very much is around neurodegeneration. What we believe the future holds for us is preventative diagnostics and personalizing medicine. And that's kind of the focus from our perspective. So it's living well for longer.
Thank you, Divya. George, your company is hosted here in White City, right? And you work in a similar way, like Divya, in frontiers of biomarkers. How do you see this healthy aging, and what new advancements in bioscience or technology can help?
Yeah, thanks very much. Yeah, so I'm George Frodsham. I'm the founder and CEO of MediSieve. We're a company based here in White City. What we've developed is a technology that enables us to physically remove specific substances directly from the bloodstream of patients. So it's a platform that can be used in a number of areas, but the way we think about it in this context in healthy aging is that we really like to focus on prolonging health, not just prolonging life, which I think is a really core objective of what we're talking about here. And we see it, there's a sort of there's two angles to this that contribute. One is sort of lifestyles and services and things like that, where it's probably the biggest role to play, to be honest, in terms of having a big impact. But we're coming at it from the science and technological perspective, where we're trying to look at the fundamental markers and cells and behaviors of the different biomolecules that are in your blood to understand how those are contributing to healthy aging in a couple of ways. The first is, how do we age, why do we age, and what are the factors that are affecting that on a real biological level? Obviously, for us as a company, thinking about how our technology might be able to come in and positively impact on those areas. But the second one is really on the long-term impact of diseases and health conditions and how they affect people as they age and how it affects their quality of life. The best known example of this at the moment is probably long COVID, which I think has brought it to the public consciousness, which I think is really interesting, where as a society we tend to be very focused on you're ill right now, we'll treat you, and then you're out of the door, thank you very much, bye-bye. And we don't think so much about that prolonged effect. And in fact, we've known about this since beforehand with sepsis, where a common side effect of those who survive a serious sepsis episode is they say, I feel like I've aged a decade. And that's not now, that is for the rest of their lives. And I think there are some really interesting mechanisms to understand about the body and what's going on internally to hopefully solve some of those problems and achieve some part of the solution towards healthy aging and longevity.
Excellent. If any of us comes with a good idea or we have something we think worth deploying in real world, Inga, we will come to somebody like you. You invest in companies which you think is going to make a difference or going to be successful. What healthy aging, what criteria will you use to say this is a good product of a healthy aging?
So criteria vary a lot for investments. We can go into that a bit later, maybe. But in terms of the thesis around healthy aging, I think similar to many of the panelists, we are fortunate in a way that we don't invest in drug development companies. It's pretty much the only thing that we don't do in health and life science. That means we start from the beginning of looking at individuals as individuals. They may be a patient at this point or will be, and ultimately, inevitably, pretty much everyone will have a long-term condition as they age, probably a few. So we think come at it from the very beginning, a very holistic viewpoint, and who are the different people engaging with that individual? Are they a user, a consumer, a customer? You know, they've got different angles in terms of business models to help with healthy aging from the individual perspective, healthcare system, all the other factors that we've talked about. So I think we have the advantage of that holistic view of not just thinking about disease, but thinking about aging. So effectively anything to do with health and wellness is really about aging.
Should I ask you first to introduce yourself? Probably for our audience, people have your profile, but in case if they haven't read, briefly.
So I represent Molten Ventures. I'm leading on health and life science in the team there. We're a large and diverse venture capital fund investing primarily around Series A, although really meanings around those phases are quite tricky, but initial check size 5 to 10 million. And we look at lots and lots of different companies and only make a few investments because we like to be very actively involved. So we'll sit on the board and support the companies. And we have then a portfolio of 80, 90 companies we're actively managing. And we can use that breadth of exposure to companies to help each other. So, if somebody's hiring a finance lead, we'll know about it and we know who else is just moving on from someone else, or we can benchmark what good looks like. And I think often coming from an academic or kind of clinical background, you don't necessarily have a good sense of what great practice looks like at different phases of companies. So that's one of the things that we spend a lot of time on. But as I mentioned, within health and life science, anything that's not drug development, so solutions, including hardware, but obviously a lot of software, healthcare systems, pharma companies, life science tools, services, we're pretty open-minded.
Let me talk about healthy aging. This is a long-term planning. This is not something we're going to change today or something. We need to think longitudinally. What are the opportunities, Dhivya? What do you think? What are the opportunities like today we can invest or we can plan, which will have long-term effect?
I think lifestyle, like one of my panelists mentioned, makes a huge impact. How you live your lives, how much you sleep, inflammation makes a big difference as well. So I think how you live your life, we need to live it more with like a lot more cognition as to the choices that we make. So how we choose to live our lives makes a huge impact. Taking physical activity makes an impact. Sleep makes a huge impact. The kind of food that we eat makes a big impact. And also regular checkups, making sure that we are aware of genetic conditions that we have. Our focus at Esya is very much neurodegeneration. So our focus is very much how can we look at preventing this disease by identifying it earlier. So healthy aging for us is very much neurocognition, cognitive longevity, and working with people to help them live better for longer.
Thank you. George, let's set something like, let's say, next 10 years. What can we do today, or what are the you think there are areas, like opportunities which we can invest today will have an impact like in the next 10 years?
Yeah, the thing about healthy aging and longevity is 10 years isn't a very long time, right? So when we talk about long term, we need to be thinking about lifespans. And I think that's actually a fundamental challenge in the area that we're talking about here, is that we need to be developing and investing in things where the value might not be tangible for 20 or 30 years. And perhaps even more challenging fundamentally, from a scientific perspective, we might not understand what the impact is for many, many decades. And I think that's a real challenge here because there are some things we know about, which I think you just mentioned. We all know that our diets and how much exercise we get, and whether or not we're getting sleep, and how stressed we are, and will affect healthy aging. But when it comes to the deep science of it, what is it that's going on in our molecules? How are different biochemical pathways interacting, different molecules? What is the role they're playing? The sort of the why and the how this is ultimately affecting healthy aging. I think we've got very, very few answers. So to your original question, I think that is where we're going to see the most movement, is actually a significant growth in our scientific understanding of what healthy aging even means on a biomolecular level.
And if I could follow up on that, I think so little is understood about aging well. We need to almost crowdsource data. How can we get more information on the different pathways that are impacted that lead to the onset of different diseases? Parkinson's as an example, 80% of people with Parkinson's develop dementia, but still we do not know and we cannot predict who would develop what kind of dementia, who's going to develop Alzheimer's or Parkinson's, or Alzheimer's or Lewy body dementia or vascular dementia. And without that information, how do you treat them? So these are the kind of questions that need to be answered going forward.
Inga.
Maybe I could jump in with an example. So we just announced an investment in a company called IMU Biosciences. This is an immunoprofiling company coming from King's College, a London friend. And they can take a very small sample of blood and get a very detailed view of what's going on in your immune system from various cell markers. And where you traditionally at the moment go to a clinic, maybe look at 5 or 6 different cell types, they can look at 2,000 and develop these kind of complex interactions and signatures of the immune system at baseline. So they can already tell what sex you are based on your immune system. It's amazing that we make the same drug for both sexes. It's kind of the most obvious difference, but that's another discussion. They can also show already how you age differently based on your immune system profiling. And then through the course of life, as we all know, when we talk about COVID, for example, that very fit, healthy guy suffered really badly because his immune system didn't respond appropriately. It's things like cell therapy, how do we pick the right donors to match with the right transplants, that kind of thing. It's all about the immune system and measuring. So I think a lot of these technologies around measuring biomarkers in the broadest sense, as you said, can have quite broad-ranging impact on aging and technologies and tools to just understand what's going on, like to George's point.
Interesting example. Nikki, you work with my colleagues in UK Dementia Research Institute and using like home monitoring technologies to improve the health outcomes in people living with dementia or people being affected by dementia. You also work on like collecting data and profiling like environmental, for example, aspect of it. How do you see these technologies you're working or the collaborations you have with my colleagues like in Imperial and in White City helps your citizens?
I think we had a really successful collaboration with you guys during COVID where we needed testing in our care homes and you managed to create a really creative solution around robotic testing analysis, which really helped us. And we had very sad events in our care homes where people with dementia were more likely to lose their lives due to COVID. I think it's worth remembering, though, that poverty is a huge kind of factor, and I think Dhivya touched on some of that. For those of us on the panel, we're able to try and mindfully make choices, whereas for a lot of our population, financial pressures make it difficult to see the wood for the trees, make good choices. So what we like to do in public health is sort of help everybody's standard of living rise so that those choices become sort of par for the course, so that, we all talk about Mediterranean diet, so that access to cheap, fresh, healthy food, knowing how to cook. A lot of people don't know how to cook. And also the other thing Dhivya touched on as well is isolation in a way. We're becoming a much more atomized society, whereas in the past we may have lived near family and friends. Especially in London, it's very lonely for a lot of people. So that's non-scientific, but be really interesting to look at how those play in.
Just clarification. Nikki was referring during the pandemic, my colleague Professor Paul Fremont, which is just upstairs from here, they changed their pipeline of, they were developing some synthetic biology. They created some COVID testing very rapidly. Around that time, I don't think I'm allowed to say how many, what was capacity, but Imperial Healthcare Trust could only test only for the capacity of even their own staff, only for a few days. And in a matter of, I think, 2-3 weeks, they could test like in range of hundreds of thousands. That again shows how working with real users and real problems suddenly you can make a massive change. On that note, Chris, one of the things about UK's funding landscape is this connection which Innovate UK does really well, connection between academics, sort of industry. Where do you think the strengths are and how we can capitalize on it to improve the health outcomes for people living in the UK and then take it and sort of globalize it?
Yeah, okay. I think the backdrop for that is almost what is the landscape that we're actually firing solutions into. I think when the Healthy Aging Challenge was first conceived, it was very much about later life. It was, these are problems here and now, on the ground, fires that need putting out. And I think what has happened over the last, say, 4 to 5 years, and the pandemic, I think, has been part of this sea change, or maybe a slight paradigm shift, if you can have a slight paradigm shift, is towards healthy longevity. So starting far earlier and thinking about the predictors of health, and obviously some of them are economic, some of them are physical, some of them are cognitive, but moving upstream. So I think I'd be almost as likely to think about something in a primary school now as I would in some kind of independent living kind of environment. And I think we've widened the breadth to think about lifelike solutions. So when we first conceived themes, I just want to give you an idea of the breadth of themes that we actually came across. So sustaining physical activity, maintaining health at work. Work is a fantastic environment to get this stuff right. Designing age-friendly homes. You know, we live in terribly dumb homes a lot of the time. We get in a car, the car will take us exactly where we want to be, it'll give us the right temperature, it'll clean pollen out of the air, it'll do brilliant things, but our homes are actually dangerous environments sometimes. Managing common complaints of ageing, living well with cognitive impairment, supporting social connection, and the social connection piece is absolutely core. I remember the Harvard study saying that if there's one thing to get right in your healthy lifestyle, it's social connection. That will prove for you against many, many things. And just healthy, active places. These days, I tend to think about the cell to the city, that actually you've got to be able to move between the micro to the macro and think about actual solutions which are going to translate, as opposed to, you know, maybe being down in a tiny piece of molecular technology to solve what? To solve what? That kind of pipeline. I think academia in this country is second to none, but the mobilization, the commercialization skills of actually moving from that to a practical, market-centric, need-based environment, I think is still a challenge.
Talking about technology and what technology can do, Dhivya, what technologies would you like to see, and what technologies do you think we can see, like, going forward, helping with resilience or healthy aging, and the themes Chris mentioned?
Yeah, I'm very excited to be sharing this panel with all of them because there's so much versatility in how we're all contributing towards aging. What Inga and Chris mentioned about information is very important. So for you students out there, it actually starts much earlier. Aging isn't something you worry about in your 40s or 50s or 60s. It's something you need to be thinking about now in your teens, in your 20s. How you live your lives today will impact you in your 50s and in your 60s. So I think what I would like to see in the future is very much communication and information, working with the NHS as well as to how we're helping people, informing them about how they can live well for longer, integrating different technologies, using AI to monitor your health baseline across your age, across different ages, and actually actively inputting changes into your life to maintain a healthier baseline across work, universities, at home, and working in the preventative area. So information, not just in how we live, but also how we understand aging. Because a lot of these diseases are senescent diseases. They occur after the age of 65, which means it's a natural process of aging. So how can there be more investment going into technologies that allow us to understand different pathways that could then lead to cardiovascular diseases, metabolic diseases, neurodegenerative diseases, and then how do we work with industry, with pharma companies to then go, right, this is the pathway where you're not aging well, here's the treatment that you need to go on, and how do we monitor that through technology such as yours? And that's what I would like to see. So preventative diagnostics and personalized medicine.
I work in AI in healthcare, and often the question I get, most of the media says AI is going to destroy us and destroy the planet, or people say, is it coming after us? Chris, you and I, we had this discussion about this. How do you see the role of AI?
It's interesting. We ran a poll at a conference we held back in November, and I asked a question of a really large audience to say, will science save us, or will behaviour change save us? And the poll came absolutely dead central, that we're going to need both, because behaviour change is possibly some of the strongest stuff that we can go after. You know, I was out on the lunch queue and I could see a donut and I could see an apple. Now, I picked up both for balance, but you know, we live in a world that has, you know, instant gratification powering it over delayed gratification, and a lot of health behaviours will be improved simply through nudges. You know, so I think AI, one of the powerful things that I think AI is going to bring is the ability to actually understand the squidgy behavioural characteristics of human beings, because, you know, as much as we're going to get the science right, the behaviour is absolutely critical to go hand in hand with it, because I still ate the donut, but I did eat the apple. But I realised that doesn't nullify it. But that's the reality of the space we're in, and AI should be able to embrace that breadth and depth of the challenge.
Thank you, Chris. Before we open the floor for questions from our audience, just briefly ask my colleagues, where do you see, what are the bottlenecks of all this? Where are the challenges or bottlenecks which, if you want to like implement all this, say, solutions which will help us to age better, healthier, where do you see the problems are? Let's start with Nikki. You represent the citizens and you have good insights into this.
One of the things that we encounter sometimes is silos in the way we work in public sector bodies, and a lot of my job is breaking down the silos between different government agencies, and I find that really fun because I'm in a very privileged position to work across the council and with the NHS. So some of the stuff that I do isn't cleverness, it's not molecular biology, it's we've got a patient, they have multiple problems. I think it's that thing that Dhivya spoke about multiple comorbidities. Sometimes the system can't cope with them, and it takes someone to bring it together, have a multidisciplinary team approach. So I think silos is one of them. I think combining funding streams is really cool, and that's a solution to the bottleneck. I shouldn't have said that one.
Talking of funding, Inga, you take the companies at early stage and you help them to grow and become productive. Where do you see the bottleneck in the pipelines you work?
So oftentimes the business model is not entirely clear because there are multiple stakeholders involved in anyone's health. Who's really paying for the technology that you're adopting? So we have a company, as an example, which is a blood pressure measurement company that uses a device at your wrist. And at the moment, everyone's had a cuff, right, on the shoulder. It's extremely old technology. And if you are diagnosed with hypertension, you should be doing that at least once a week, month, or regularly. And the compliance is extremely low. So if you can have a passive way of measuring your blood pressure over time, you get those patterns, you get that engagement in your health, and it makes it a lot easier to collect the data which will engage someone for a long-term outcome. Because if you could do that, you don't want to see the impact of the donut for 10 years' time, but, you know, with your blood pressure, and it's a recognition that, you know, any sort of direct-to-consumer product in this field, we're human, so we do something, we get a health kick for 3 or 4 months, but it's very hard to create a sustainable business model in a direct-to-consumer market in this way, because, you know, we've all done it. So if you have a condition, a long-term condition, hypertension affects more than 50% of people over 60. So, you know, there's a way of recognizing, okay, it's here now. We've all got one coming, but eventually you get one. What are we going to do about it? And that, at least that nudge of motivation, that behavior change, that increased access to data shows how your decisions are impacting your health. And that's just one example in blood pressure. So I think that long-term, short versus long-term, which you mentioned as well, kind of engagement with health. And access to health. So again, just 2 other examples from portfolio. One is using AI. So we have an online therapy company where you connect with a therapist and you chat. Actually not seeing people helps people open up. But the company's been running for over 10 years and they've treated over 120,000 patients. So now they have 600,000 or more hours of therapy on their fully recorded transcripts. Fast forward to the release of ChatGPT, we all know what that means now, is you can feed that into a generic model and start building truly AI-assistive, highly relevant, highly curated CBT, cognitive behavioral therapy, is a very structured way of doing therapy anyway. So you really can believe in the promise of this sort of chatbot to massively augment the opportunity of access to care. So that's for patients that are clinically diagnosed, anxiety, depression, that kind of thing. But there's something else in prevention. So another company we've invested in a kind of a similar sort of space is in employers. Somebody mentioned employers. In your life, as we think about life, spend a lot of time at work, and how you feel at work has a big impact on your health. So this is a benefits program focused on mental health and wellness called Oliva. And there you may or may not have a diagnosis of XYZ. So it may or may not be relevant for you to go to your GP. If you can give people the tools to understand why they're feeling so terribly anxious, speaking in front of 200 people, I don't know, what can you do to build that resilience in the workplace before you've got a diagnosis? And you can have massive long-term. Just a few examples.
And George and Dhivya, you operate in this space, like you have your businesses. Very briefly and quickly before we start the questions, what are the bottlenecks for you, George?
Yes, I think there are a lot. So I mentioned one at the beginning, which is I don't think we have a particularly good fundamental scientific understanding of a lot of the things that contribute to aging. And I think that's a major bottleneck because we just don't have the data sets. One thing AI is very good at is analyzing data. One thing it's not very good at is collecting data. And I think there's a huge amount of work to do there before we can draw some conclusions and understanding. I think there are huge bottlenecks in the public space from what the government could do, should do, how people react, how you measure impact, I think is super challenging. Clinical studies I might come on to later because that's a little bit of a bugbear of mine. But to pick up on one thing you said, Inga, I think that understanding who pays for it and the business model is something we obviously have to think about a lot because we're a for-profit company. We need to bring in investors. We need to show that we're going to make money. But we also need to ask the question of who profits, right? Because in any transaction, both parties should be happy. I'm happy to not have this money because in exchange I got a sandwich. I used to be hungry, now I'm less hungry. And I think that in these things that are preventative sometimes, it can be really challenging to define who's profiting in its long-term benefit and who should pay for that benefit. Is it society? Is it government? Is it public? Is it the individual? I think those are some really challenging questions that we haven't answered as a society yet in this case.
Way of looking at it. Dhivya.
To expand upon what Nikki said and also George in terms of what Nikki's point on silos and George's point on insufficient awareness on what causes different diseases. I think one of the key bottlenecks is collaboration. I don't think one company or one organisation is going to solve this problem. We need to work together to try and understand these diseases and understand aging much better. As an example, we work with molecular markers that profile a particular pathway that's dysfunctional in most neurodegenerative diseases, the endolysosomal pathway. But very early on, we realized actually just profiling that pathway isn't going to be sufficient. So we approach this in a very multi-omic way. So we included genetics and transcriptomics and proteomics, and we did that through partnerships with other companies. And we share our data. So it's not just industry collaborations. We also work with universities like Cambridge, the Charité, with Columbia University, to then enlighten ourselves and each other on what could be causing these diseases. So I think one of the key bottlenecks is we all need to collaborate more, not just digital markers, molecular markers, imaging-based markers, and then also therapeutic pathways. Imagine how much further we could go if we all joined forces and shared our data.
One of the missions of this event, and my colleagues have put a lot of effort, and thank you for you to joining us, is actually to cultivate this collaboration and the idea is working collaboratively. Thank you for joining us, and you have been a wonderful audience, and thank you, my colleagues, for your contribution.